This video sequence will demonstrate the evaluation of the body and tail of the pancreas using the radial echoendoscope. We're going to begin the examination at the GE junction, and you can see that we're endoscopically placing the transducer right at the GE junction. Now we've turned on the ultrasound imaging, and we want to orient the image so that the aorta is at the 6 o'clock position and the liver is at the 11 o'clock position. Once you achieve this, you can see that the crura of the diaphragm is seen wrapping around the aorta. This is important because as you advance the scope, once the crura of the diaphragm disappears, you should be looking for the takeoff of the celiac artery. And the celiac artery is one important structure that leads you to the body and tail of the pancreas. So we've advanced the scope, and you can see that the celiac artery is taking off at about the 10 or 11 o'clock position relative to the aorta. And the celiac artery bifurcates into the hepatic artery and the splenic artery. The splenic artery loops underneath the transducer, as you saw there, and then with further advancement, we now locate the body and tail of the pancreas. You can see the confluence of the superior mesenteric vein and the splenic vein, and you can see the superior mesenteric artery. This is a standard position imaging from the stomach, looking at the body and tail of the pancreas. And a clockwise shoulder turn and a slight withdrawal of the scope will send the transducer toward the body and tail of the pancreas. A leftward torque and pushing in will send you more toward the neck of the pancreas. You can see here that we've torqued a little bit clockwise and withdrawn. And with that, we can now see the left kidney that's at the 3 o'clock position. And you can see the splenic vein deep to the pancreas. With further clockwise rotation of the shoulders and further withdrawal, we now see more of the tail of the pancreas, and we now see the spleen, which is at the 3 o'clock position, and the splenic vein running deep to the pancreas, going into the hilum of the spleen. So this is the essential maneuvers, if you will, to see the body and tail of the pancreas. Rightward shoulder turn and withdrawal to see the tail of the pancreas, the kidney and the spleen, and a counterclockwise shoulder turn and an advancement of the scope to head back toward the neck of the pancreas. And you can go back and forth as much as necessary to interrogate the entire body and tail. In some of these images, you can see the pancreatic duct coursing through the middle of the gland. But this is the standard technique for imaging the body and tail of the pancreas with a radial echoendoscope. This is a video sequence demonstrating the use of the curvilinear echoendoscope to evaluate the body and tail of the pancreas. We begin the examination at the GE junction. We find the aorta. Then you can see the first artery taking off is the celiac artery, and the one distal to it is the superior mesenteric artery. We're going to use the celiac artery as a tracer to show us where the pancreas is. You trace the celiac artery until it bifurcates into the splenic and hepatic artery, which you can see here. And then from this point, a little bit of tip down and advancing the scope will bring the pancreas into view. This particular patient has a cystic lesion in the neck of the pancreas. Here you're seeing the neck of the pancreas with the pancreatic duct going around the genu. And then as we torque clockwise, we follow the rest of the pancreas, which includes this cystic structure in the neck of the pancreas. But from the genu area, you use clockwise torque and slight withdrawal of the scope to see the rest of the pancreas. And here you can see, as we're adjusting a little bit, torquing left and right, we reorient ourselves at the level of the cysts, And then you see a large swath of the pancreatic duct now coursing through the pancreas. Again, using a little bit of right and leftward torque. There's the pancreatic duct underneath the crosshatch. And you can now see a very long area of the pancreatic duct coursing from the left to the right-hand part of the screen. So it's a little bit of gentle clockwise and counterclockwise torquing with this instrument. You can withdraw it now a little bit more to fully interrogate the tail of the pancreas. You're beginning to see the kidney come into view deep to the pancreas. This highlights the junction between the body and tail. There is the kidney. It's the left kidney deep to the body and tail of the pancreas. So this shows you that you're in the right area. The pancreas is right on top of that. Further withdrawal and torquing will ultimately bring into view the spleen. So here we're tracing the tail of the pancreas, keeping the pancreatic duct in view. We're slightly withdrawing. Then you will see coming into view will be the spleen. That's coming into view on the right-hand side of the screen. Once you see the spleen, you can be assured that you've pretty much seen the extent of the tail of the pancreas. And now once you've seen that and seen the spleen, then you can begin the maneuvers of counterclockwise torque and pushing the scope in to then reinterrogate the pancreas. So there's the left kidney and the spleen, and those are markers for imaging the body and tail of the pancreas. So now we're torquing back and we're pushing in just a little bit, and there's a nice long swath of pancreas right underneath the transducer. And then you can repeat these maneuvers as necessary to fully interrogate the pancreas.
The body of pancreas can be found from the mid-stomach by first locating the left lobe of liver. The scope is turned 180 degrees clockwise and the pancreas will come into view. This maneuver is particularly useful in patients with surgically altered anatomy, hiatal hernias, and aberrant celiac artery takeoffs, where the alternative technique of following the celiac artery to the pancreas may be difficult.
This video sequence demonstrates the evaluation of the head of the pancreas using the radial echo endoscope. We're going to accomplish this from two different positions or stations, and the first one demonstrated is the position that we call kissing the papilla. So it's a matter of advancing the echo endoscope into the second portion of the duodenum, ideally visualizing the papilla of Vater, inflating the balloon, coming up on your up-down so that you're literally kissing the papilla, and then you begin imaging. And as you can see here, with ultrasound imaging beginning, we've inflated the balloon, and we now see the aorta. And this is a critical structure to know that you're fully evaluating the head of the pancreas. So it is best if, from this position, you can image the aorta. We've rotated the image so that the aorta is on the left side of the screen. And when you do that, as you withdraw the scope, the pancreas will come into view at the 6 o'clock position. So you can train your eyes at the 6 o'clock position to begin seeing the pancreas. As you see it, it will be typically a salt and pepper kind of pattern, and it typically is crescent shaped when you're imaging with a radial scope from this position. And here you can see the pancreas beginning to come into view. And you need to be a little bit careful because too much upward